If you suffer from fungal infection, along with skin itching and allergy, then this medicine is a magic for you. Today's video is regarding avocom-m cream. We will discuss, what is avocom-m cream, its uses, how to use, its special instruction, and its possible side effects. Avocom-m is a combination of two medicines, Miconazole, which is antifungal, that works by inhibiting the growth of fungus, and some associated bacteria which also may be present, and Mometasone, which is a synthetic corticosteroid, that reduces inflammation, swelling, redness and itching of the skin, associated with fungal infection. Avocom-m cream is used to treat below-mentioned conditions including athlete's foot, that usually begins between the toes, jock itch, which affects the private parts, ringworm, which is circular rash and is usually red and itchy, pityriasis, a fungal infection that causes a lightening or darkening of the skin of the neck, chest, arms, or legs, for skin inflammation and itching associated with fungal infection. Now let's see how to use this cream. Some fungal infections are contagious, so always wash your hands before and after the treatment. Use this medication on the skin only. Clean and thoroughly dry the area to be treated. Avocom-m cream should be applied evenly to the affected areas, 2 times daily, and rubbed in gently. Use this medication regularly, and use it at the same time each day. The duration period to apply the cream is 7 days, but it can be prolonged to 1 month, according to your skin condition. Stopping the medication too early may allow the fungus to continue to grow, which may result in a relapse of the infection. Do not use avocom-m cream if you experience sudden swelling of the face, lips, tongue, or severe allergic reactions. Some special instructions related to this cream are: always wash your socks, stockings, tights, underwear thoroughly in hot water to remove any fungal spores. Don't allow sweat, especially in your private parts, underarms, as it result in growth of fungal infection. Discard the tube after 3 months from opening. Do not apply this medication in the eyes, nose, mouth, or vagina. Some of the side effects which you may experience are burning, stinging, itching, and redness. If you have any question or suggestion, just drop below, we will answer that.